I'm Reg Dennick, and what we're going to be doing in this workshop is moving on from my presentation on assessment, and in this workshop we're going to get you to actually write some assessment questions, some objective test items. We sometimes use the term items synonymously with questions, so don't worry too much about that. So test items. So the learning objectives for this session are that we should be able to describe and explain objective testing, list and describe the two main types of objective test formats. We're going to be looking at what's called single best answer questions and extended matching questions. And then I'm going to talk to you about how to write those two types of questions and give you a framework that's a recently developed framework that's very useful for writing lots of these sorts of questions. And then, because it's a workshop, you're going to spend the rest of the time writing questions. So do be prepared to write some questions on your own and in groups and pairs and talk to people about it. And we've got Professor Hans Bijlsma with us here, who's an expert on this, and he's going to be wandering around and giving you feedback, and you can talk to him about the sorts of questions that you are writing. Is that okay? So that's what's on the agenda. Just a little bit of reiteration of what I told you before. This is we're in the realm of knowledge, so we're writing knowledge-based questions. We're not involved in practical questions or attitudinal questions. This is purely to do with writing objective questions about the knowledge that people have. And you will recall that there's different levels of knowledge that people can have. So at the bottom end of the scale, we have the sort of recall, remembering of factual information, which is important, but it's a relatively low-level skill. And you can, recalling, recognizing, naming things is a relatively low-level cognitive skill. Understanding is slightly more complex, where you're interpreting or summarizing or explaining things, and then you've got application, where you're using information to solve problems and so forth, and analysis is slightly higher as well, where you're organizing and differentiating things. Evaluation is quite high, so in particular critical evaluation, where you have lots of evidence and you have to make inferences, deductions and inductions, is quite a high level thing. And then at the top end of the scale of knowledge is you're actually creating new knowledge. And in fact, one of the things you'll be doing, ironically, shortly, is creating questions. So you're going to be working at the highest level. But let's talk about assessment. These are the types. These are often described as the sort of objective type test questions. You may be familiar with what are called dichotomous questions. These are true-false questions or yes-no type questions. These are no longer recommended by many of the major assessment organizations, either in the UK or in the United States. Multiple choice questions are the ones we're going to concentrate on, or sometimes known as single best answer questions, where you choose the correct answer out of a list of options. One from X, and we'll talk about what X is. Sometimes it's 4 or 5. Could be 3, could be more, and we'll talk about how that number X varies depending on what you're trying to do and the importance of it. Multiple response questions are when you have more than one correct answer. So you might ask people to choose 2 correct answers out of a list of 7, or 3 from a bigger list of 9, or something like that. Okay, and then we have extended matching, where you're matching one list with another list. Often one list, as we will show, might be a list of clinical scenarios, and another list might be a list of diagnoses, or it might be some management options, or some drugs, or some investigations, and you're matching one list onto the other. But really, secretly, behind the scenes, it's just really an advanced version of multiple choice. It's basically the same thing, where you've got multiple things. On the right-hand side, you'll see MFQs. That just means multi-format questions. It's just a generic term to describe these multi-format questions. We're not going to be talking about ranking, where you put things into order. Hotspots you can do with visual questions where you have a mouse, for example, and the question might be identify the pancreas in this MRI scan. When you think about it, it's actually an elaborate version of multiple choice, where the whole of the image are all the incorrect answers, and the right answer is sitting in the middle, and you've got to sort of click on it. We won't ignore, fill in the blank is when you have to put missing words into sentences. So we're going to be looking at multiple choice or single best answer questions and extended matching. So here's a typical multiple choice or single best answer question. In this case, we've got one correct answer and X is 5. So there's 5 options. Now, this is where I need to explain to you that the most difficult thing about writing single best answers is not knowing what the correct answer is. It's knowing what all the incorrect answers are. And it's being able to write plausibly incorrect answers. Do you all understand what I mean by that? Plausibly incorrect. So the great skill in writing these sorts of questions is to be able to identify a clinical area, put a correct answer in, but then put incorrect answers in, which are very closely related. We sometimes use the word homogeneous, so that the correct answer is homogeneous with the incorrect answers, not heterogeneous, because then it becomes very difficult. Then it becomes very easy to identify the correct answer. You want the person to have to use their knowledge to work out the difference between them. You don't want them to be able to be, oh, I can spot this without knowing anything, You're measuring knowledge. So anything that allows students to answer a question that doesn't involve the knowledge involved will reduce the reliability of the test and will create noise in the test. There are other ways of doing that. This is a typical one. Here's one where you have an image. So you have in this one you've got a clinical scenario at the top. You've got a supporting graphic. Okay, and then in this case you've got 6 options, and one's correct, and the others are known as distractors. Did I say that? That the others are known as distractors. They distract you from the correct answer. Okay. You can have it doesn't have to be words. It could be symbols. It could be images. This is a rather trivial sort of question where you have to identify a symbol. And then we move on to extended matching. Now in this, you basically have you have 2 lists, and you're matching one list against the other. There's a range of these questions, this variety of questions. Usually you have a short list and a longer list. So if you had a short list of, say, 2, you might have 7 options to match it to. If you had 3, you might have 7. And the more you have in one list, the more you increase the other list. Okay? And here's a typical, this is a sort of cardiology question. And in this case, you haven't got a clinical scenario, you've just got cardiac conditions. So at the bottom, you've got 3 cardiac conditions, and at the top, you've got sort of abnormal findings that you might find on examination. You've got to map the 3 at the bottom against the appropriate abnormal finding that you might hear on examination. So that's that one. And then if you were doing it on a computer, as we increasingly do these days, so if you have online assessment, then in this case you'd have your scenarios, and you'd click on, and a drop-down box would open up with the options, and then you'd simply click on the appropriate option in the drop-down box. So again, here you've got 4 scenarios, and you've got 7 options.
Isn't this the same as for multiple choice, single answer?
Well, it is. I said it's basically the same thing, but the thing about extended matching is you can pick 4 closely related clinical scenarios and then have lots of options. It is. I said to you before that extended matching is really just it's an extension of multiple choice questions, but this time you're confronted by, instead of one clinical scenario and a series of options, you're confronted by 3 clinical scenarios and more options, and you have to match them to each other. So you're quite right, it is very strongly related to the single best answer or multiple choice.
But in your previous slides, it's less easy, I think, to have separate questions. With the previous example,
that's really the same thing, isn't it? If you think about it. Here you've got four scenarios and 7 options. Here you've got 3 scenarios and 10 options.
This is one question, and in your scoring,
Yes.
do you use it as one question?
Well, that's another issue, whether you have to answer all. You can either give 1 mark to each option that's correct, or you can say you've got to get all 3 correct. That's a slightly different thing about how you score the question.
I don't know if it really fits here. This is just because you mentioned it several times that nowadays computer assessment is used more and more.
Yeah.
And so I'm just looking at it from a legal point of view, because at our medical school it is mandatory actually that you have really a paper version, and this paper version is archived.
Yes.
So the real test is archived for a period of time.
Yes.
So how can you avoid that a student actually files a lawsuit that there was a mistake in the computer system?
Well, that's an interesting question, but we can't really go into it
Because
here.
if you really have a paper,
Yes.
then you have a paper, and you can always say, okay, this is the paper, and you cannot.
Just because it's on a computer doesn't mean you can't convert it into a paper-based copy, though. There's no reason why you shouldn't be able to do that. And in fact, in the early days, in my medical school in Nottingham, we actually pioneered the use of online assessment. And in the first few years, in the examination place where we did the examination, we had to have paper copies of the question, but just in case the computers went down, and we could give them out. So doing it online on a computer does not mean that you can't have a physical printout that you can store. All right? And you can also archive the computer system as well. So here's another extended matching where you've got an image. So in this case, it's an ECG with 4 elements on it that you then have to label. So that's a relatively straightforward one. And here's a nice rheumatological one, an X-ray showing some erosions or whatever on some joints, and you then have to identify and label the correct thing. So again, it's like multiple choice. It's like single best answer, but the advantage of using the extended matching is that you can take multiple clinical scenarios that are closely related, and it really makes people have to think much more heavily about how to differentiate between the two. So it really pushes their cognitive levels higher than just picking one single best answer. Before I move on, I just wanted to, I don't know whether I mentioned this, but the number of distractors is important. I don't know whether I've mentioned this already, but if you have, say, 1 from 4 or 1 from 5, what happens if you start to increase the number of options? What would be the problem about trying to do that? You know, A, why would you want to do that? And B, what problem does it start to cause as soon as you start to increase the number of options?
You need more time.
No, I'm thinking from you as writing the questions.
It's so difficult to find one answer that
Yes.
is plausible but not true.
That's right. This is what I was saying. The challenge of writing good questions is finding plausible, incorrect answers. So I have a colleague in Nottingham. He's an expert psychometrician, and he said if he had his way, he thinks what would be even more reliable if you had 1 from 3, because it's much easier to come up with 2 options which are very closely related to the answer. As soon as you have 4 or 5 or 6 or 7, it becomes increasingly difficult to actually come up with an option which is plausible. In some cases you can. If you can, But we normally stick to, say, 1 from 4 or 1 from 5 in terms of... is that your experience of these sorts of questions? So,
the previous workshop had an example that somebody made 5 answers, but 1 and 5 were in fact the same in other words. So it was easy for the student then to take both of them out.
yes.
So
Yeah.
sometimes not even...
Oh, that's right. And anything that allows the student to delete options without the knowledge that you're testing will create unreliability in the test and will come out as a... excuse me, when you analyse it statistically, the reliability of the test will go down. So, moving on, we're nearly there, and we're just going to go through how you can actually write some of these questions. So, make sure the item can be answered without looking at the options. I mean, this is, I suppose that's obvious. One of the interesting features of writing single best answer questions is that you have a scenario and a question, and then you put the answers. And of course, in a way, what you're doing, you're being helped to find the answer by it's actually presented to you. So if you see the answer, and they go, oh right, I remember that, it's that one. Imagine if you didn't have the answer and the distractors, that you would have to answer it without. But in principle, you should be able to answer the question without seeing the distractors. So make sure the items can be answered without looking at the options. It's obviously harder without the options, and in fact people have studied this, and it's around about 20 to 25% harder to actually answer the question without the options as it is if you actually give people the options, if you actually look at marks that would be awarded. You have a big stem and short number of options, so that a big clinical scenario and then a small number of options. The options are small. Write options that are grammatically consistent and logically compatible with the stem, so that if they're not, people will immediately spot them as being incorrect. Traditionally, this is not absolutely essential. List the options in alphabetical order. The distractors, as I've said to you before, the incorrect options should be of the same type as the correct answer, so they should be homogeneous as opposed to heterogeneous. They should be roughly the same length, instead of having a very long answer option and some very short ones, because people will start to sort of think that one of them is more correct. The one with more information in might be perceived to be the one that's the correct answer. It's only a perception. And then avoid using words like always and never, because medicine is not like about always and never. And people will immediately think, well, an option that's got always or never in is unlikely to be true, for example. It's not always the case, but it often is. And some terms such as usually and frequently, if you put a question and you said, what is usually associated with the following, and what is frequently associated with the following in a question, your conception about what usually and frequently is may be entirely different from what somebody else. There's no universal knowledge about what is usually and frequently. If necessary, put actual epidemiological figures in about the incidence or prevalence or something like that if you want to do things like that. What you're trying to do is to avoid the test-wise candidate from answering the questions without using the knowledge that you're trying to test. Anything that allows a student or a learner or a candidate to answer the question without using the knowledge that you're trying to test is going to generate unreliability in the test. The test-wise candidate always notices that incorrect answers do not follow grammatically from the stem. That's a relatively unusual thing, I have to say. They bet that always and never options are unlikely to be true. They notice that correct answers tend to be longer and contain more information, and they maybe notice that an answer word occurs in the stem. So what I'm going to do now is give you a framework to actually write some questions, and before we do that, I just need to could you just take one of these and pass it along? So what this framework is, this was published last year in the in Medical Teacher, and it's a useful framework that you can use to write single best answer or multiple choice questions, and you can also use it to develop extended matching questions. So what I'm going to give you is an example. I'm just going to talk through this example. Then we're going to have a look at a rheumatological one that you could work on. And then I'm going to get you to write your own questions based on this framework. And then if you really go for it, you can write some extended matching questions as well. So let's just have a look at this. So here you're given 4 potential diagnoses of chest pain. So you've got myocardial infarction, pulmonary embolism, costochondritis, and aortic dissection. And then underneath it, you've got, say, 4 management situations for that particular condition. And then below that, you've got some information about that differentiates these 4 conditions from each other. So, for instance, in the MI one, you've got heaviness, pain, you've got radiation to the jaw, you've got nausea, blood pressure, ECG, ST elevation, and so forth. And by using this information and selecting, imagine that you're going to select, okay, I'm going to write a question in which MI is the correct answer. So then you would write a clinical scenario based on the information in the first column. So have a look at that. That clinical scenario is written at the top. So all that information in bold is based on the information in the first column. There's a few other things that have been added in, like, for instance, heart failure is JVP is 4 centimetres above the sternal angle. That wasn't mentioned, but it does say heart failure. And so then you've got what is the most likely diagnosis, and you've got MI, and you've got the 4 other distractors put in there as well. And then, or alternatively, the question might be, what is the most important step in managing this patient? Okay, so that's hopefully a very simple example of how you can do that. And in principle, if you go back, you could imagine you can write 4 MCQ questions based on that, can't you? 1 for each clinical scenario. And then similarly, you could do an extended matching one where you have 2 scenarios, and then you have multiple, maybe put some more potential conditions in that would go beyond just 4, but then you might have trouble trying to come up with some plausible examples of chest pain that would fit. So let's now have a look at one that I haven't done. This is one for you to look at. This is a rheumatological example now. So using the same framework, and we're in the realm of acute joint pain. So now we've got osteoarthritis, gout, fracture, inflammatory arthritis, rheumatoid arthritis, septic arthritis, so any other acute joint pain you want to put along there. And then you can imagine underneath, you could put management if necessary, if you want to go down that route. But then, in all of those cases, you could put presenting features or pain characteristics of each of those, or associated symptoms of each of those, or the physical findings or blood test results, for example, associated with each one of those. And then that would lead you to be able to come up with potentially 5 or 6 or 7 multiple choice questions, all based around this idea of acute joint pain. So you begin with Mrs. Smith presents with an acutely painful knee, for example, and then you pick the appropriate information from each of those, and then at the end you would then say select the most probable diagnosis with 3 or 4 distractors, or in that case, here you've got 1, 2, 3, 4, 5, 6 potential distractors. Okay, did you get the idea? And you could use that to also write an extended matching question where you'd have 2 or 3 clinical scenarios and then a series of diagnoses. So what I'd like you to do then is you can either have a go at doing that, writing some questions on the basis of that, or if you'd like to, from your own area, it doesn't have to be acute joint pain, you can choose another area, particularly where you can have multiply, you know, you can have related diagnoses in a particular area that you would want people to be able to differentiate between. Is that clear to everybody? So have a go at doing, you can do that on your own, or you can do it in twos if you like, if you want to work together. But at some point later on, it would be nice if you could share your questions with somebody else. And Professor Hans is going to be wandering around, looking over your shoulder and giving you feedback, and I will be doing the same thing as well. Okay? Thank you.